Tara here from Aging Your Way. So, how can you tell if your non medical home care agency staff are doing what they should be? Today, I will answer this question and others like it because home care can be really confusing sometimes. Too often, I see people put off hiring a home care agency, and then once they desperately need help in the home, they rush into choosing the first agency they can find. If you are paying someone to come into your home to help you, don't you want to know exactly what they should be and should not be doing? If you are receiving or planning to receive medical home health care, please watch my YouTube video titled Confused About Home Care, Part 1, which has valuable information about medical home health care. But if you are receiving or plan to receive non medical home care and want to know what the agency staff should and should not be doing, please continue watching this video. If you aren't familiar with what non medical home care is and the typical services provided, please watch the second YouTube video in this series titled Confused About Home Care, Part 2. Now, on to the important tips to keep you and your loved ones safe when receiving non medical home care. Number one, please hire an agency to provide home care services, not an independent caregiver. The reason people are tempted to hire an independent caregiver to perform home care services instead of an agency is simply that it's cheaper. But people don't always think about the risks that they are taking when they hire an individual who is not employed by a home care agency. If you are adamant about hiring an independent caregiver instead of a home care agency, I'd encourage you to think about what you will do if the independent caregiver sustains an injury while caring for you or your loved one. They may expect you to pay for lost wages or medical expenses. Or what if you notice cash or valuables missing in your home after the independent caregiver was there? Or what if the independent caregiver breaks something valuable in your home while they were using it? Or what if the independent caregiver is sick and cannot care for you or your loved one? Do you have a backup caregiver in place? A reputable home care agency performs background checks on its staff to ensure that no one with a criminal record cares for you. And a reputable agency should have liability insurance. This should ensure that if a valuable item is broken or missing while agency staff are present, you would have an opportunity to be reimbursed. One side note related to this: liability insurance for a home care agency is more expensive than most people think. That, combined with overhead costs such as office lease, paying off the staff, business software, etc., all contribute to the hourly rate that a home care agency charges. As I mentioned in my last post, the caregivers usually are only paid about 50% of the hourly rate that you are charged, but you should not assume that the other 50% is going directly to the agency owners. They have overhead costs just like any other business. The bottom line is receiving home care services through a reputable agency reduces your personal risk and liability. The higher hourly rate is likely well worth it for you to hire an agency instead of an independent caregiver. Another important tip to know about non medical home care agencies: they are not heavily regulated or licensed in most states. As I mentioned in part 1 of this video series, medical home health agencies are required to follow strict regulations imposed by the Centers for Medicare and Medicaid Services. These regulations do not apply to non medical home care agencies, although agencies that provide non medical home care reimbursed through the Medicaid waiver program do have some regulatory requirements they must follow. One last tip to keep you and your loved ones safe: please know that all staff who visit you in your home should always wear an official picture ID badge with the staff person's name and photo, as well as the agency's name. If someone comes to your home without a picture ID badge, feel free to turn them away. Staff wearing picture ID badges is now standard in all areas of healthcare to keep you safe. When you have a need to hire a non medical home care agency, I recommend you interview at least 2 to 3 agencies if possible. And please do it before you desperately need the home care services right away. Finding an agency that is a good fit is extremely important, and this isn't a decision that you want to rush into. When you are screening and hiring a home care agency, I recommend asking the following questions. 1. What is your hourly rate? Does that hourly rate increase on weekends, evenings, or holidays? Another important question is, do you have a minimum number of hours per day or per week that I must commit to? I would recommend asking, do your caregivers have any special training based on what I or my loved one need? An important question to ask is, how much notice will I receive if you have to send a different caregiver than the one I planned on? Along with that, I recommend asking, what does the agency do if my caregiver calls in sick at the last minute or doesn't show up at my home? You will want to know if they will be able to send a replacement. I would ask the home care agency, what should I do if the caregiver you send me just isn't a good fit for me and my loved one? And a question many don't think to ask, but I think it's important. You want to know who owns the home care agency. Some home care agency owners make an effort to meet all their clients or at least call all of them to ensure they're happy with their services, and I think that's a good thing. I would also ask the agency, do you offer a free in person consultation so you or a manager can meet me, see my house, and discuss what services that I or my loved one need? Lastly, I recommend asking, how much notice does the agency need if I need to change my caregiver hours? Based on my experience, I recommend you be cautious of any agency that immediately says yes to everything you ask for or dismisses any of the questions above as no problem. Staffing hourly cases for multiple clients is complex work, and in my observation, the best home care agencies who do it well have multiple caregivers available to fill in for last minute staff cancellations.
And just for you, the 10 questions to ask a non medical home care agency before hiring them is located at agingyourway.net under resources.
So, what should you expect of a caregiver from a home care agency when they come to your home? Continue watching to find out. Your caregiver should help you or your loved one with whatever was agreed upon at the initial meeting when you signed up for their services. Also, when the caregiver is not busy, they should offer to do homemaking tasks such as light housekeeping, organizing a cabinet, meal preparation, etc. They should be very kind and respectful towards you and your property. What should a caregiver not do when they come to your home? They should not go through your personal things without your permission. They should not ask you or your loved ones to pay them separately from the agency, not even for gas money. They should not ask you or your loved one to pay for their personal grocery items when at the store. Your caregiver should not eat your food unless that was agreed upon in advance with management from the home care agency. And they should not invite people you don't know to your house or bring their own children to your house. And your caregiver should not be disrespectful to you or your property. In closing, I have a request. Please be kind to the people providing care for you. While there are definitely some apathetic people out there who work in home care, most are truly just trying to help people. And I can assure you, they don't do it for the big paycheck. If you have any sort of concern or conflict with a caregiver, please go to the management of the home care agency right away. And if the issue is not resolved to your satisfaction, you always have the right to hire a different agency. I have worked with many families who choose to employ two different home care agencies at the same time, especially if they absolutely need several hours of care each week. For some people, this reduces their stress knowing that they have multiple options for caregivers. Please don't hesitate to look into this valuable service of home care to help you and your loved ones safely age in place in their own home. It is much better than a hospital or nursing home stay. If you would like more information about non medical home care, please read my latest blog post titled Confused About Home Care? You Are Not Alone, Part 3, at agingyourway.net under blog. And if you would like help with determining if you or your loved one needs home care, feel free to click on the Services tab of my website to learn about our Aging Advisor services. The initial 30-minute consultation is always free. Thank you so much for your time. Feel free to leave a comment below if there are other topics like this that you would like me to discuss. And don't forget to like and subscribe below as well.